Risk assessment and genetic counseling are covered in Standard 2.3. All programs are required to provide cancer risk assessment as well as genetic counseling and testing, on-site or by referral, by a qualified genetics professional. With the expanding knowledge base about genetic predisposition to various forms of cancer, cancer programs must begin educating patients about their cancer risk, assist them in making informed decisions about genetic testing, the timing of various cancer screenings, and cancer prevention strategies based on their personal genetic makeup. The importance of this standard is far-reaching, identifying patients with family histories of specific cancers and others with hereditary cancer syndromes can affect early detection as well as survival. When one receives a cancer diagnosis, the question of "why me?" often comes up. A discussion about family history may bring forth information that should be investigated with genetic counseling at the very least. Whether or not that leads to genetic testing is a decision for the patient and genetic counselor. Cancer risk assessment and genetic counseling have become a new standard of care. Meeting the standard is a matter of Cancer Committee defining the qualified genetic professionals, the process on how patients will be identified, and how referrals will be made. Cancer care providers within the cancer program should be aware of this process and whether it's provided on-site or outside of the program. A program fulfills the compliance rating when there is a process in place for identifying appropriate patients for risk assessment and genetic counseling. And Cancer Committee has identified the appropriate genetics professionals for referral. The designated professionals must possess the experience and educational background in this specialty so as to provide the full scope of their practice. A program can attain a compliance rating when cancer risk assessment, genetic counseling, and testing can be provided on-site or by referral. Documentation for this standard includes completing the SAR and discussing the process for providing this specialized service with the surveyor at time of survey. The referral process should be written so that it is clear to whom the program refers and includes their qualifications. The Multidisciplinary Cancer Conference is an opportunity for discussing a patient's potential for referral. CTRs can employ a checklist or grid to ensure the topic is addressed. Another way to identify patients who can benefit from this service is by including brief questions about family cancer history on physician intake forms. This could open a dialogue on cancer risk assessment and the need for genetic testing and counseling. Thank you for viewing this video on the COC standards, and remember to view the remaining videos in this series to further increase your knowledge on the standards. For additional resources, be sure to visit the COC website at www.facs.org/cancer to access the COC Educational Portal, Best Practices Repository, and Cancer Forum.